Okay, welcome everyone. It's wonderful to see so many of you here today. My name is Polly Hunt, and I'm with AARP Massachusetts. And I'm honored to be collaborating with Brigham and Women's Hospital and Maria today to offer this fall prevention webinar as part of our November caregiving series. It is officially Caregiving Month. As many of you know, advocacy is at the heart of what AARP does, whether it's protecting essential services, fighting fraud, or promoting age-friendly communities. We fight every day to make sure older adults are heard, valued, and supported. AARP is proud to be part of the legislative priority titled An Act Supporting Family Caregivers. Advocacy isn't just about raising awareness, it's about helping people thrive every day. That's why we're so pleased to partner with Brigham and Women's Hospital to bring you programs like this engaging series, which is designed to nurture real well-being for caregivers and people and those that they support. Today's session focuses on fall prevention, which is a subject that's not only timely because we're entering the winter months, but essential for staying strong, balanced, and connected through the caregiving journey. Today, we are honored to have Maria with us, who serves as the Injury Prevention Project Manager at Brigham and Women's Hospital. She brings over 4 years of experience in the implementation and evaluation of community-based injury prevention initiatives, including fall prevention. In her current capacity, she oversees program operations, directs data collection and analysis, and leads efforts dedicated to minimizing preventable injuries and improving community health outcomes. Maria holds a Master's of Science in Immunology, blending robust scientific training with practical expertise in public health program management. She's certified in several evidence-based and nationally recognized programs, such as Tai Chi for fall prevention, Bingo Size, Stepping On, Stop the Bleed, Basic Life Support, and CarFit. Driven by her commitment to advancing injury prevention, Maria applies data-driven approaches, fosters community partnerships, and promotes educational initiatives to enhance safety and improve quality of life across diverse populations. So Maria, welcome. We're so happy that you're here today with us, and I will hand it over to you now.
Hi, Polly. Thank you for having me. Thank you to AARP for agreeing to host this event. I am very excited to be here. And as you said, this is the core of my job is to go out in the community and talk about fall prevention. Shall we just jump right into it?
Absolutely.
Okay. So I will share the slides and we'll go from there.
Great. And Maria, I'm just going to take myself off camera, but the slides are up and I will help manage the Q&A. So as you have questions in the audience, for those that are joining us today, please put your questions in the Q&A and we will get those answered.
All right. So, as Polly said, we will be talking about fall prevention. Um, we'll just move on. So, I am an injury prevention professional. I do not give formal medical advice, and I provide education on fall prevention and information on different programs. If you have any medical questions, please consult your primary care physician. So, what are we going to see today? We are going to talk about facts about falls. And really, my focus is on prevention strategies. And we'll talk about fall prevention programs. There's a section on how to get up after a fall, and we'll have some resources. So, just a quick question for everybody. As you see, it's blank. Why are you here today? Why do you want to learn about fall prevention? And as Polly said, feel free to put your questions in the Q&A. So NCOA, there was a study that was put out and surveying the elderly population and just asking, why do you want to learn about fall prevention? So one of the main reasons is so that we can continue to do the things we love. A lot of times falls actually do prevent us from continuing to do our normal activities. So a lot of times, learning about fall prevention will keep us independent. So we can spend more time with family and friends. Again, falls, when they happen, is very, um, what is the word I'm looking for? It can get very disruptive for normal family life. And the last reason is we want to stay healthy and independent as we get older. I hear this a lot from the many different populations I speak with. As I said, I work with a lot of elderly populations. And this is one of the things, this is one of the major things that I hear a lot. We want to be independent, and we don't want to depend on our kids as we get older. So we want to stay healthy so we can keep doing what we want. If this resonates with you, that's great. And these are definitely, like, for me anyway, like three major reasons why I would want to learn fall prevention. So everybody knows what a fall is. So we'll just quickly go through this. What is a fall? Basically, it's an event that results from a person coming to rest from inadvertently on the ground or floor or another lower level. Okay, so you're coming from standing up to being on the ground. So just some quick stats about falls. As we reach the age of 65 or older, our chances of falling is 1 in 3. Not, it's pretty high. And a lot of that has to do with the aging process, how we've always lived our life, and a lot of physical issues. As soon as we hit 80, we have a 50% chance of falling. One fall doubles your chances of falling. And 1 in 5 people will suffer, over 65, will suffer serious injuries. And we'll talk a little bit more about that in a bit. Falls cause 95% of all hip fractures, and we do get that a lot in the hospital. Women fall more often than men, and falls are the leading cause of fatal and non-fatal injuries. So what are some of the risk factors for falls? I think a lot of you know what this is, what some of these factors are. So we have weak muscles. This really pertains to leg muscles. So strong leg muscles is a big deal for fall prevention. Poor balance. These two are two of the most important variables in fall prevention. Strong leg muscles and balance. Polypharmacy, this means taking 4 or more medications. And as we get older, we do tend to take more medications than we did when we were younger for various reasons. Lack of sleep. When we're drowsy, we don't pay attention. Improper footwear. And that goes with foot pain. Both cause us to walk differently. So it changes our gait. And when our gait changes, it puts us at risk for falls. Vision and hearing changes, and home hazards, as well as alcohol use. Polly, are there any questions so far?
Let me see. I don't see any questions. I just see some comments which were in the Q&A about people's tendency to fall because of balance, but no questions yet.
Okay. So we'll move on. So what are some of the consequences of falls? We always think, physical injuries, and that is very true. And this can range from non-serious injuries like bruises and pain to a lot of other more serious injuries such as hip and other fractures. Traumatic brain injuries is also quite common. Outside of physical injuries, we do have emotional injuries as well. So the fear of falling usually sets in, and that is from someone who may have fallen once. Depression, distress, anxiety, all of that usually come around after someone has fallen and has to deal with recovery and isolation after and during and after recovery. There's of course, the financial cost, both um, in pocket and hospital stay. And another big consequences for falls that I like to talk about is social consequences. This again comes from decreased physical mobility. So a lot of times when we have fractures, um, we can't go outside the home. So we are stuck inside, not being able to do what we normally do. So not being able to go about our normal activities. And that as well comes loss of independence. So a lot of times we have to depend on other people to help us with our daily activities of living, showering, bathing, cooking, dressing. So a lot of things that we don't even think about, no, things that we take for granted, we now will need someone's help to do them. And then, of course, the isolation that I mentioned earlier, coming from the fact that we're now stuck at home because we are not able to go out because we can't walk. So I actually speak to the experience right now because I've just had foot surgery and I've been stuck at home for a week now and I haven't seen anybody except my husband. And then, of course, there's that government and community costs. Now, all that being said, most falls are preventable. And I really want to focus this talk on this. How do we prevent many of these falls? So there, as you probably already know, there is a gazillion, well, not gazillion, but there are many ways on how we can prevent falls. So I have actually put them in four different buckets. One, we stay physically active. Two, um, see a medical professional. Third bucket is making changes in our lifestyle. And the fourth is making our home safe. Again, at any point, if you have any questions, please feel free to put them in the Q&A and we'll answer them as soon as we get them. Okay, so staying physically active. Why? Why do we care? Does anybody have any answer to that? So physically active. One of the big reasons why we want to stay physically active is because it strengthens our muscles. The more we use our muscles, the stronger they become. So basically, muscles are one of those things where you use them or you lose them. The more we sit around, the more we just not use them, the weaker our muscles become. So it's really critical that we use our muscles, whether it's walking around, strengthening, anything like that. Being physically active keeps our joints, our tendons, and ligaments flexible. And I'm sure you guys know have experienced this. I know I have. So if I don't move, my knees freeze up is my best thing to put it. And I'd have to walk around a little bit to get them oiled up. It improves balance. Major, major point. By being physically active, you're improving your balance. And it doesn't matter just walking around the house, walking as an exercise, doing whatever, going to the groceries, any physical activity will always, as long as you're moving, you're working on improving your balance. It improves the heart and lung function. It increases our HDL or the good cholesterol. And this is the one that always goes down in mine. Controls the blood sugar and it also controls weight. So as you can see, being physically active really addresses a lot of different issues that we encounter as we get older. So what are some of these activity goals that we have when we're being physically active? One, we should always have a balance or do a balance of aerobic exercise, strength training, balance training, and flexibility each week. So, and we'll talk about each one in a little bit. So that's basically a combination of different types of activities, not just one. Secondly, a minimum of 150 minutes of moderate aerobic activities each week. So, what do we mean by moderate? Moderate really is, say, you're walking. As you're walking, you're able to talk, but not sing. So, if you're able to sing, well, you might want to pick up the pace a little bit. 150 minutes sounds like a lot, but it's actually 2.5 hours each week. So, that being said, 2.5 hours doesn't have to be done all in one shot. It can be spread out through the whole week. So if you do 30 minutes each day, 10 minutes in the morning, 10 minutes in lunch, 10 minutes in the afternoon. So it can be spread out and in what we call snacking, which is essentially doing something, a little bit of something for a short amount of time, but until you get to your goal. Muscle strengthening activity should be done 2 days a week or every other day. And a lot of that goes to the fact that our muscles need to rest after being used for this type of exercise. The other thing is keep your cell phone with you. And that's a lot for safety. Any questions about these so far?
We do have one question that came up, but the person also said, this might be covered later, but what are the recommendations for fall prevention for a senior in mid-stage Alzheimer's? My mother is in good physical shape for 85 years old, but in mid-stage Alzheimer's. She is appropriately conscientious about walking now, but I want to plan ahead for when her attention span starts to diminish. So if you are covering something like that later, Maria, you can address it then, but if not, that question came up.
Okay. Actually we're not.
Okay.
But a lot of times with especially with Alzheimer's, the really important factor is having someone with them in case of accidents or if something happens. Obviously, we want to keep the phone with you, but really being not just physically active, but also a lot of mental exercises. But basically, we're looking for similar types of activities that we want, even if we didn't have Alzheimer's.
Mm.
I don't know if that answered the question.
Yeah, that makes sense.
Okay, so what are these aerobic exercises? Aerobic exercises are essentially just activities that speed up your heart rate and makes you breathe a little harder. As I said before, a little harder meaning you can walk, you can talk, but not sing. So these are just this, it's not just aerobic activities are not just walking, it can include dancing, swimming if you have access to a pool or access to a swimming area, and biking. So it's not only walking, it's any activity that speeds up your heart rate and makes you breathe a little harder. Just a quick aside. When I said this minimum of 150 minutes, um, this is a CDC recommendation. If you can get to 150 minutes, that's wonderful. If you can do more, that's great. If you can, um, if you're below 150 minutes, it's fine. So essentially, at this, what we're saying is it's better than nothing. So what you can do is better than nothing, and that the more you do it, um, the more it becomes better. The more you can do it. But in other words, don't push it. Go at the pace, at the safe pace that you have until you can get to your goals. Muscle strength activities, these are activities that challenges and strengthens the muscles. And these are usually done with some form of weight. So a weight could be in the form of resistance bands. They can be free weights or they can be body weight. So if you notice with resistance bands, they usually have different colors. So those colors usually, and they're not this, unfortunately, they're not all the same for every type of band. So the colors signify different strengths or different weights. Okay. So the bands that we have, yellow is the lightest, basically, it's the easiest to use. Then blue is the middleweight, and then green is the hardest or the heaviest. So check on the corresponding, basically, how hard is it to pull, and that tells you how much the weight is. Free weights, as you can see, that already that's also you can check the label. And body weight. Body weight, even if you're not attaching anything, your body or just the act of lifting a body part, you're already going against gravity. So it provides weight, it provides resistance. And that's really what you're looking for is some form of resistance. Okay. Balance and flexibility training. So a lot of this are in the form of yoga and chair yoga, tai chi, and water-based exercises. Water-based exercises, if you have access to this, these are wonderful. A lot of water-based exercises, they cover strengthening components, they cover balance, the water provides resistance. So if you have access to this would be wonderful. And all these, Tai Chi, yoga, chair yoga, they all address balance, which is another critical component of fall prevention. All right, so before we move on to the next bucket, are there any questions about this, about physical activity?
I don't see any questions in the Q&A right now, but just a reminder, people can put questions in there if anything comes up.
Okay. All right, so the next bucket is basically see your medical professional. Your PCP, feel free to talk to your doctor. Don't be afraid to ask your questions. No question is stupid. So be always comfortable to ask your questions to your doctor. It's very important for a good number of reasons. So you want to see your doctor for regular checkups. If there's a new fall, and a lot of times I know a lot of people don't let their doctors know if they've fallen because why would you? I didn't get injured. So a lot of that is just to let them know that a fall happened because sometimes injuries come up days later. Okay, so if there's something that came up and you're like, I don't understand what this is, a fall could explain that. So um, just it's more on the FYI. If in the FYI portion, just letting them know. If you want to start a new exercise program, it's a good idea to get a green light from the doctor. Medications and side effects, always a great idea. A lot of times your PCP can see all the medications that you're taking and how these medications interact with each other, as well as their side effects. Another really great person to talk to about medications, your pharmacist. Having your eyes and ears checked. Diet and nutrition. Anxiety and depression. So many times, maybe your PCP won't be able to help with anxiety and depression, but they can also give you a referral to someone who can, to a professional who can. So it's always a good idea to be open to our PCP about this. And the fear of falling. Yes, this actually is real. And again, it's a great idea to mention this to your PCP, again, for, maybe having someone to talk to about it.
Maria, we
All
did
right.
get a question, sorry to interrupt,
Mm-hmm. That's
that
great.
was related to this. So the question is, do you know if any MGB, so Mass General Brigham internists, are doing preventative fall assessments in their yearly Medicare checkups?
So, a lot of doctors nowadays, a lot of PCPs nowadays, for them, the first question they usually ask is, have you fallen? Have you had any new falls? That's been a big initiative lately. So if they don't ask you that, just bring it up. And fall assessments, I believe for Medicare, there is actually an annual thing that they have to ask. Again, don't hesitate. If they don't ask, you bring it up. My suggestion, bring it up and talk to them about it. There is in CDC, there's actually, and I think I sent this one to you, Paulie. There's an assessment about falls, the Stay Independent brochure. That's actually a fall assessment that you can take yourself.
Great. And we'll be sending that out afterwards.
Okay. All right. Moving on. So, just a little bit something about medication safety. So, it's always important to know your medications. What does it look like? What is it for? And how often do you have to take it? These are critical, especially for just, talking to your doctor about it, talking to your pharmacist. And you also want to tell your doctor about all the medications you take, the number of medications. And this includes the supplements, the vitamins, anything herbal supplements that you buy over Amazon, anything like that. And herbal supplements, we usually think, well, why does that have to be? Why do I have to tell your doctor about it? Herbal supplements may have an effect on our other medications. So a lot of supplements, vitamins, anything like that could affect the medications that are prescribed to us. So it's always important that our doctor knows what all the prescribed and over the counter and supplements that we take so that they have the full picture when they look at what's going on. And also, if they don't bring it up, ask them about the side effects of your medications. This is really, really important because a number of side effects for medications, including drowsiness, dizziness, and blurry vision, can also increase chances of falling. Also, write down any changes. For me, especially, as soon as I walk out that door, all those, changes that he told me, gone out. It's so I always take that little piece of paper that they give you and read over it just to make sure that, I understand if there are any changes and I remember them. Any questions about medications? Okay.
I have just a more of a comment. It looks like it says that goes with teas on the market, like kava, for example. I think that's more of just a
Um,
comment, or
the herbal teas.
I'm guessing that's what they mean. Yeah.
It's always important to just let them know if these are herbal teas, like, if you're taking valerian, for example, that's a very popular tea for sleep. Um, let your doctors know because valerian tea, if it doesn't have any effect on me, but that's just me. But it obviously it makes you sleepy. The goal of it is to make you sleepy, and so it's important that your doctor knows about that so that they can take that into account, especially if you're, taking other medications for sleep or anything like that. Lifestyle changes. All right. So, what are some of these lifestyle changes that we want to be aware of? Again, coming back to medications. So, take your medications prescribed, especially if it's prescribed, take them as prescribed. Really important. Eat a balanced diet. If you are prescribed any assistive devices, canes, walkers, hearing aid, glasses, use them. Now, when it comes to canes and walkers, and feel free to ask if you have any questions about that. A lot of times people use them even if they're prescribed because of the idea that A, it makes them look old, and B, it makes us dependent on it. It's actually the other way around. Walkers and canes encourages someone to walk, gives you support for balance and continued activity. And remember what I said, continue physical activity, always have physical activity. And if you have to use a walker or a cane, that will help with continuing physical activity. So in that process, we're getting stronger because we're still continuing to walk to places. Otherwise, if we don't use a walker, what we're gonna we might end up spending more time sitting down because we're not comfortable, we're scared of walking, or we're not comfortable with mobility because we're not confident. So using the walkers and the canes are actually very helpful. Hydrate with water. Yep, good old plain water. Limit alcohol. Get enough sleep. Again, drowsiness is a big factor. Natural vitamin D, sunlight. So a lot of this comes from the fact that vitamin D helps our body absorb calcium into our bones. And calcium, as you know, is good for our bones. It strengthens our skeletal system. So as we get older, our hormonal imbalance affects our skeletal system. So the more we can encourage calcium absorption into our bones, the better, the stronger our bones become. And natural vitamin D, being out in the sunshine, being out in the fresh air, it's not just medical, it also has a lot to do with how we feel. And just a quick aside, especially in the summer, you don't want to be outside for too long because that would then be dangerous. So if you want to spend time outside for natural sunlight, you want to be outside avoiding 10 to 2. So anything between 10 and 2, it's the sun becomes really strong, especially in the summer. And maybe 15 minutes, especially in the summer, and a little bit longer in the winter when the sun isn't as strong. Stand up slowly. This is really important because it has to do with our blood pressure. So our blood pressure is different, or it changes when we're lying down versus standing up versus sitting down. So we've gotten a lot of patients coming in because they've fallen because they get up too quickly or they're getting up from bed to go to the bathroom. So what we want to do is if we're in bed, sit down, give yourselves a minute or so to let your body, your blood pressure equilibrate, then stand up slowly. This is to avoid falling from, sitting down, from lying down to standing up. So a lot of that is just blood pressure changes. Wear non-skid rubber-soled low-heeled shoes. I think a lot of us do this now. Really important, especially now as winter's coming. Don't rush. Don't rush, don't rush, don't rush. Again, rushing, we don't pay attention when we're rushing. So that usually will lead to falls. And we've gotten a number of patients coming into the hospital, to the ED, because, I was rushing to answer the phone. I was rushing to go to the bathroom. So we actually have three things that we, aside from, so don't rush. So no rushing, no plopping, and no shuffling. That's my like golden motto right there. So no rushing, no plopping. This is when you drop yourself down to a seat and you go plop. You want to sit down slowly and get up slowly. And no shuffling. Shuffling our feet when we're walking. So take those steps. Shuffling leads to falls. Okay, so make your home a safe haven. This is when I really want you guys to, like, if possible, just really jump in and make those comments. So I'm going to be showing pictures of different areas in our home. So ask yourselves this question. How long have you been living in your home? And has your home changed? Have you changed? So a lot of us have lived in our homes 10, 15, 20 more or more years. So our home, it's our home, it's our house. That's where we live. And we're comfortable. But what we also want to remember is that our home we've set it up so that it works for us. But at the same time, as we get older, we change, our needs change. So we need to make our home match with the changes that we are experiencing. So what I'm going to show you are just different pictures of different parts of the home. And if you could just put on the Q&A, I'm going to ask you to look at the things that you like or the things that you think are safe. Okay? Safe or what you like. And then what are some of the things that you think are unsafe or what you deem needs changes? And what kind of changes would you make? All right, so here's a picture of the living room. So for the first question is, what do you think is good about this? What are some of the good things that you see? What are some of the safe things that you see? I hope you're putting them on the Q&A.
Maria, I'll keep an eye out for you. I see someone just put in that they're 73. They have floor tiles. What's the best flooring for me? But that isn't that's just a general question.
Well, it's going to be difficult to change flooring, honestly. That's a major remodel right there. But we can also change the what we wear. So I think your best bet would be to change what you wear on your feet. So definitely, especially tiles, rubber soled shoes.
So we do have some feedback about what is good in the picture, and someone has written that there are no rugs to trip over in the picture.
Yes, yes, definitely. No rugs.
Good. And then we also have someone mentioned the stairs.
Yep. If you
Clear,
notice,
yep,
good.
clear pathways as well.
Mm-hmm. So there's rails on the stairs. That's a big, big plus. One thing I want to mention, if you have if you have stairs in your home, try and keep one hand free. I know me included, I carry as much as I can when I'm going from, floor to floor, but try to keep one hand free. So if you need to hold on to the rail, you can. Okay. So try and keep one hand free.
Someone else also said that the lighting is very good. And then we have a few
Yep.
comments about what is not good. So,
Okay, so let's do what's good first, okay?
okay.
So
Yeah.
we have the rails and we have no rug. And yes, the lighting is good. It's pretty, it's nice and bright. All right, so what are some of the things that need to change?
So there's a lot of clutter by the
Mm-hmm.
stairs, which is a hazard. And someone noticed also the computer cord.
Yes. So we have clutter, lots of clutter. And if you notice, there is clutter on the stairs. That's a big no-no because that's a major slipping hazard. And we have cords. Yes, cords are, we've gotten people coming in because of these cords. Again, a lot of times we get used to them being there, so we don't see them anymore. And that's when they cause trouble.
And
Anything
then
else?
Yep, another comment was about the can on the floor, and
Mm,
someone commented on the table, just in general, nothing specific, but
yes, there's the can on the floor. Again, you hit it, and if something spills, if there's there's liquid in there, it's a spilling hazard now, and it becomes a slippery hazard.
And
Definitely.
we have confirmation that the table comment was about the edges. They're concerned with the edges on the table.
Yep. Anytime you fall, we don't know what we're gonna hit.
Mhm.
So definitely that table can be a concern. All right, moving on. Bathroom, same thing. What are some of the good things you see?
We'll wait just a sec here if people want to put stuff. Okay, grab bars is positive. There's
Mm-hmm.
the tub railing. Yep, we have people saying the bars is all very positive.
Yep. Grab bar is definitely a good thing.
There's a shower attachment.
Yes, the shower is good when we need it. Yep, definitely. Okay, what are some of the things that need to come into the picture? Now, what are some of the things that we need to add or fix or
So one person commented that the need for a walk-in shower would be better.
mm-hmm.
There was a positive that said there is no rug to slip on.
Mm-hmm.
It says the toilet is too low.
Yep.
These are all great comments.
Yes, definitely. I'm so happy to see that you guys are seeing these.
Yeah. Then we have it's too high to step over the walk in the shower. So, yep, that would
Yep.
be similar.
That's definitely an issue for a lot of people.
Yeah, yeah.
So if you notice, I red flagged the no grab bar here in the right here. Oops. Because we need that is actually an important one, especially if you're stepping over the tub. We need something to hold on to. Okay. And just something about grab bars. If you're gonna get grab bars put in, please don't use any of those that are the suction kind because the suction kind can come loose. Okay. Use grab bars that are screwed into the wall. So for those who need a shower chair, obviously there's no shower chair here. We actually need a bath mat for this. And yes, it's good not to have anything, but remember, as you're stepping out of the shower, your feet are wet. And tiles and wet feet do not mix, they are not friends. So we do need a bath mat with a rubber backing. And one of the things that we always say is get one that's colorful, that stands out so that you can see it and it tells you right away, hey, I'm here. It brings attention to it. And a lot of that is you see the bath mat, you say, like, okay, I need to be careful around it. You need a bath mat because when you come out of the shower, we need to put our feet on something that is not slippery. Okay. Um, Wet floor, any spills on that floor, please wipe it up right away. We've had several people coming in because of spills in the bathroom. There are also grab bars for the toilet, by the way. It just, it's put on so it helps you get up. The other thing, somebody did mention, this would be nice if we had a non-slip, like a walk-in shower, but that's a big deal. That's a big remodel. Another important thing, if you have a tub, use a non-slip, anti-slip mat inside the tub. Um, Very, very critical. And as mentioned, there's a grab bar for the toilet. This one, kitchen. What are some changes that what are some good things that you see in this kitchen?
We have here lots of sunlight.
Very nice and bright for sure.
Yep, and the counters are clear.
Counters are clear, yes. Something else about the counters.
They're clean.
They're
Um,
clean.
Yep. And one person said put their low.
Yes, that's what I was looking for. Put the things that you use the most on a lower counter,
Hmm.
lower shelf, so that you're not reaching up. Okay, you're not reaching up constantly. So anything that you use all the time, put them on the lower shelf. And a lot of that is when you're reaching up, our tendency, if we can reach it by going on our tippy toes, our tendency is to use a step stool. And I am not in favor. A lot of my colleagues and I, we're just not in favor of step stools. We've heard too many stories of step stools. So if you can avoid that, please don't use a step stool. Have someone else come and get it for you. So what are some of that needs to be changed?
Someone said get the cat out of there. That's funny.
Uh-huh.
Um, I think a positive still was in the chat that the faucet does not require turning.
Yes. Yes, for sure.
And the suggestion, I think, to not have a rug because that rug looks pretty slippery.
Okay. Very true. So if you notice, mop up those spills by the sink. Wood and water, same thing. Any floor, really. Any floor and water, not friends. Very slippery. And I know a lot of times, I know when I'm doing dishes where I'm at the sink, I turn around and I sprinkle water everywhere. I don't notice it. So mop up the spills. This has been a source of, many a fall. Yes, area rug. Get rid of that rug. And yes, pets. Pets are a big slipping hazard, tripping hazard, especially cats because they're so quiet.
We have a few more comments that came in. Someone put
Mm-hmm.
that the lower oven could be dangerous when lifting hot food.
Yes. Yes.
And then I think a positive is having the open cupboards below.
Yep, definitely. Those are big helpful. The other thing I wanted to mention that I actually never actually occurred to me here because this doesn't have it here. One of the couple of times we've had people come in because they tripped over an open dishwasher door. So, you're loading the dishwasher, you don't close it and turn around and trip over it.
Yeah,
So, if you're ever using a dishwasher, just keep that in mind, close it if you're not, you know, because that's actually because it's so low, that's a hard one to trip over.
yeah.
Well, no, this is an easy one to trip over.
We have a question that came in reference to the pets. So why is everyone encouraging dogs for older people? They get close to a person's legs the same as cats do.
I don't know the answer to that, honestly, because dogs are also a tripping hazard.
Mhm.
So I don't know. Maybe they provide more support. I don't know. I wish I could answer it. Okay, the other couple of things. Avoid using cleaning products that contain wax or oil for your floors because those make the floor slippery. And again, avoid using those step stools. And then if you must have those area rugs, use double-sided tape to secure the rug to the floor. Bedroom. Anything good? Anything bad? By the way, before you say anything, this is the person's shoulder. It looks like a head. The first time I saw it, I'm like, there's a third person there. That's the person's arm and shoulder. So what are the good things you can see here?
Let's see. There's a clear
Anything?
path to the bed and no clutter.
Yep, definitely no clutter. So there's no clutter. And as much as there's a rug there, it's a big rug. So it's not going to slip easily. But still, always a good idea to either put double-sided tape, especially on these corners here, because those corners are the ones that tend to flip up and cause a tripping hazard, or put one of those rubber underlayment that keeps it from being a tripping hazard. Anything that you see that are dangerous or you should be aware of.
We have a few more positive comments that
Go ahead.
there's the lighting is good and there's easy access to lights. there,
Mm-hmm.
and it looks like the bed height is good as well.
Right, that is a big deal. The height of the bed nowadays, they seem to be getting higher and higher. You have to like jump up to get to them. So, definitely true. As we
Um,
get older, it might be a good idea to get a lower bed.
yeah. Then we have a question. What about reaching from bed to high lamps? That's more of a question.
Ah, um, that all depends on where that if that lamp, if that switch is making you reach far or reach over a lot, that could be dangerous. If it's like, within easy reach, then it's fine. But if it's making you reach out and lean out, that could be dangerous. So I would bring the lamp closer or change the lamp or make it so that, remember, I don't know if anybody remembers the clapper. Remember that?
Hmm. Hmm.
Something like that.
We have a negative here that the dog is sleeping by the bed, which could be bad because you could trip over him or her.
Yep, definitely the dog is a tripping hazard. Anything else? Okay, so we were talking about that reaching over. See, this nightstand's too far. If you're gonna reach for a book and you're reaching, I can reach it, I can reach it, yeah, until you can't. So nightstand should be closer to the bed so you're not reaching out too far. My father-in-law has done this and has fallen. If you notice the blankets on the floor, not very easy to see, but that's a tripping hazard right there. Blankets on the floor. That's how my mom broke her hip. Sleeping pets. When it's dark, you can't see that pet. Come down for, go to the bathroom, step on the pet, and down we go. Also, use night lights, especially on the path to the bathroom. Use a night light and make sure there's no clutter on that path. Okay, so outdoors, we go outside, check the mail, take out the trash. What are some of the good things that we see here?
There's lots of lighting.
Definitely lots of lighting. That's a very good thing. What are some of the things that we would change or we need to be aware of?
There's no rails on the stairs, and there are lots of steps. We have that a few times, no rails.
Yep. So we have the puddles, which in the cold can turn to ice. Wet leaves, very slippery, especially now that it's fall. We need to be aware of that. The driveway is uneven. So, when it's uneven and we're not expecting it, that can lead to a fall. And yes, no rails. Really important. Okay, I have
We've
one more. Again, we're outdoors, taking a walk. What are some of the things that we should be aware of? What are some of the things that you're like, that could be dangerous?
we have uneven pavement.
Yep.
Yep, crack in the sidewalk, same thing. And then someone with good eyes mentioned no sandals. That's a good one too.
Mm-hmm. All right. So one, the curb. We need to be aware of the curb. Sometimes the curbs are high and we don't take a high enough step. Or this happens more often, is stepping off the curb and not judging the height of it and falling that way. Uneven sidewalk. Yep. Very, very common, especially in Boston. Actually, everywhere because of those trees.
We have a few people who
Improper
noticed,
footwear.
oh, sorry, the dog in the back. We have a couple people who noticed the little dog in the back.
Ah, I'm so glad you did. Yes. And if you notice the dog, you notice the leash and then the pet. So the dog is in the back. So none of these guys know where the dog is. And if you notice the woman is holding that leash, she's in front. So the dog is in the back of everybody. So that leash is now a tripping hazard. So these are just some of the things that, as we go on our daily lives, daily activities, we just want to be aware of them. And that's a big, oops, that's a big part. It's just really awareness of what is going on around us. And just so, in the back of our heads, we're like, okay, there's unevenness on the sidewalk, like 6 steps ahead of me. I'm aware that I can take steps to not trip. So just, this is really just that. It's a situation, I mean, environmental awareness. Just be aware of what's going on in the environment. And so we can take steps to mitigate them. All right. Any other questions? Any questions about these? Okay. So these are just some of the helpful tools that we have. Um, the long-handled shoehorn, so we don't have to sit down to go and get up to put our shoes on. Grabbers, I'm sure everybody's familiar with the grabbers. If you have to reach for something that's high up. Rubber grip socks. And one thing, just be aware that at night, if you wear them at night, they do turn so that they could become slippery. And these are thresholds. So sometimes there are rooms where the threshold, one floor is higher than the other. So these bring your attention to that. And it's also kind of levels off the threshold. Some fall detection devices and ways to ask for help. Your cell phone is always a big one. Alexa is a big one. The watches nowadays also have that. I just wanted to talk about some evidence-based fall prevention programs. So if you find any of these in your area, please look into them and try to, see if that's something you'd be interested in. So Matter of Balance. So these are multifaceted. That means they talk about exercise, nutrition, different aspects of fall prevention. So Aging Mastery Program, Bingo Size, and Stepping On. This list here is more exercise oriented. So there's Tai Chi for better balance, Otago, and Sail. So Tai Chi, as we all know, is a low impact or non-impact. So it's really good for the joints. And they've been proven time and time again. It improves balance, flexibility, some strengthening. And so Tai Chi for fall prevention in particular is a Tai Chi program that's evidence-based, and it's been shown to improve balance and flexibility. So it's been studied, and it's been worldwide. So there's been a lot of studies that's been done for this. Stepping On is another program that the Brigham and Women's Hospital Injury Prevention Program runs. This is a multifaceted program. So we talk about balance and strengthening exercises, medication, vision, and home modifications. So a lot of times we have experts, like a pharmacist comes in, PT comes in to talk about different issues. Bingo Size is a fun program. Again, another evidence-based program. This is a game of bingo, and within the program, within the game, are exercises. So we do health exercise, we do upper body exercises, we do questions, health questions. So it's not just bingo; it's combined with other with education and exercise. So this is a quick view on if you fall. So first of all, stay calm and decide if you're in pain or hurt. If yes, do nothing and call 911. If the answer is no, I'm not hurt, the next question is, can you get up? If the answer is no, call 911. If the answer is yes, then we have this little infogram. So you want to roll onto your side and try to get into a crawling position and crawl to a sturdy chair or steps. Then you want to get on to the furniture and try to get the goal is to get your bottom, so you're sitting on it. The other way is by scooching. If you can't go in your crawling position, scooch on your bottom and call your doctor. So final message, stay physically active, see a medical professional, make changes in your lifestyle, and make your home safe. So these are some of the brochures that resources that we have. Again, these are CDC brochures, and NCOA and the NIA are always good sources of information. NIA is the National Institute of Aging. NCOA is the National Council of Aging. Um, any questions? That is the end of our talk. Thank you again for joining me, and thank you, Polly, and thank you, AARP, for having me. I appreciate being able to speak to everybody.
Thank you, Maria. We've got just a lot of accolades in the chat here, thanking you and saying it was a wonderful presentation. And just as a reminder, we will have the resources as a follow-up after today's webinar. And we thank everybody for joining us. And thank you so much, Maria. This was wonderful.
Thank you again. Appreciate
Great.
being here.
Wonderful. Take care, everybody.
Bye, everyone. Enjoy the rest of your week.